afternoon, everybody, and a very warm welcome. We'll just give people time to join us as Charlotte's letting everybody in, so to speak. If you can put yourselves on mute for the time being, that would be very helpful. So thank you. I can see the numbers are still rising, so I'll give it a minute, perhaps another minute or so, because I know we're only together for half an hour this afternoon. But we'll just give it a minute or so for other people to join, and then we'll make a start. Okay, I think we're stabilising around 46 colleagues with us at the moment, so we will make a start. So a very warm welcome and a good afternoon to you all this afternoon. I hope you're doing okay with the weather and that nobody's too snowed in. My name's Tracy Hill, and I have the great fortune to work for HPMA, and absolutely delighted to join Alison to join us for this afternoon. And Alison's going to lead us through the presentation. Can I, as I've said, can I please ask that you keep yourself muted for the time being? If you do wish to ask any questions, make any comments, please do. That would be great, and put it in the chat, and I'll keep my eye on the chat box. And then just one final thing from me is we will be recording this, because in line with what we do with all of our webinars, it will be available on the HPMA website for other colleagues to have a look at, and similarly for you to refer back to if you want to do after the session. So without further ado, as they say, I'll hand over to Alison. Thank you very much, Alison. It's over to you.
Thanks so much, Tracy, and for the kind introduction. And again, thank you so much for letting me to attend one of your HPMA webinars. I'm delighted to be with you this afternoon. I'm just going to share my screen and bring up the presentation. And I'm also going to maybe ask a couple of questions as we go, so please feel free to post responses in the chat, and we'll monitor that. If you've got anything that you want to ask, please again raise your hand and we'll take it through as we go. So I'm more than happy to take questions as we go along. So my name is Alison Johnson. I'm VP of Customer Success at Orca, and Orca stands for the Organisation for the Review of Care and Health Apps. We work with many UK healthcare organisations. We cover around about 70% of NHS organisations across England, but we also work with Scotland, with Northern Ireland and with Wales, some of the Welsh boards. And then we've got an international presence as well, with building out digital health frameworks as part of our assessment work in a number of countries, such as New Zealand, the US, Canada, Australia, and Europe as well. So before I get into the workforce challenge, I guess I just wanted to basically express the context in which we all know we're working at the moment. It's challenging, very, very challenging times in terms of the context of healthcare delivery, of workforce retention, and also of recruitment into posts across the NHS. And I think that whilst we recognise that digital has a significant role to play in the transformation of workforce, equally, I want to express that I am well aware of the challenges that many of you will be facing working in the organisations in which you work currently. So the starting place really is what is the background to what we're trying to do, and some of the priorities and operational guidance that's been set that we're trying to work towards. So there is something about growing a substantive workforce, enabling people to work differently, and keeping focus very much on the health, well-being and safety of staff and the patients. But it's also about using what we learned through the pandemic, the rapid acceleration that we saw in the way that digital could be used more effectively. So the fact that we're all here on a webinar using Zoom today as an example, if we think about 3 years ago, this probably would have been a trip to London or Birmingham and a half-day session. So just thinking about some of the tools that we have available to us and how they can maximise our ways of working, but also for our patients. And then working in partnership around resource to make more effective use of the resources that we've got. The majority of the work that we do within the UK is very much at an ICS level. So we're working across systems of care and understanding better how digital health applications can be supported across the system. So, you know, thinking about primary care, mental health organisations, community, acute, those whole patient journeys that touch on every single point of care across the system. And again, just thinking about the funding opportunities that are available through digital health as opposed to more traditional ways of working. So acknowledging the context in which we're working. But within that context, there's a significant opportunity for us around digital health and how we support that. We know from the work that we've done as an organisation that 93% of healthcare professionals believe that digital health technologies can actually help and support patient care and treatment. And we see that in the work that we are doing across different sectors. We also know, and this, you know, I wouldn't have believed this before I started Orca, that 83% of people who've used an app have said that it's improved their health and well-being. And more importantly, that 52% of over 65s are willing to receive digital health technology as part of their treatment. And I think that one really stands out for me, because certainly when we think about digital literacy and working with hard to reach groups, quite often we think about elderly populations and would they be able to use digital health technologies. So actually the research that we're pulling through demonstrates that they're actively wanting to be prescribed digital health. Over 5 million people will download a health app every day. And I guess one of the challenging things for us and the work that we do at Orca is understanding
Alison, sorry, I think you've gone on mute.
Sorry, not sure how.
There we go.
Happened.
That's great. Thank you.
Back again. Sorry, I'm just moving boxes across so I can get to play from current slide. So of all of the apps that are available, if we think about 5 million people downloading a healthcare app every day, we also know that there are over 365,000 digital health products that are available to people. And so how do you know what is safe and effective, and how would you prescribe something to a patient? And this is where the work of Orca comes in. So we actually created a standardized approach to assessment of apps and created regulatory frameworks. And through that work, we know that only 20% of apps that are readily available across the market on the Apple Store, on Google Store, 20% of those meet the health and care standards that you would expect to see. So we work really closely with NICE as part of the evidence standards framework. And we constantly monitor any new product that comes to market, and we provide an assurance before it even gets onto an Orca Health app library. But we're well aware in organisations, and you may be aware of this within your own organisations that you work, that health apps are used regularly and not part of a regulatory framework. So I myself have been in a GP surgery, and the GP has kind of waved their phone at me and said, you could always try this app here and that would help. How do I know it's safe and effective? And so I guess this is one of the challenges that we've got. We know that digital health can make a difference, but how do we make sure that it's as safe as it can be in the organisations we're working? And I guess ultimately for yourselves, in terms of that whole governance of workforce in organisations, how do you provide that assurity so that we're able to make sure that the training that we're offering to staff is safe and effective too? So if we think about let's just take another area of healthcare. So let's think about how drugs are prescribed. Something that we will all have experienced, we go for a consultation with either a GP or a specialist, and if we need a prescription, we don't ask the questions because we know there's a governance route in place. That governance route starts with trust. Because the MHRA will have made sure that any drug that's approved is licensed and goes onto a library of drugs that can then be prescribed. That's signed off by NICE guidance before it even makes its way into a British formulary. And that British formulary is where awareness then occurs, that formulary is made available to healthcare professionals so that they can be assured when they're prescribing a drug, that there's information that backs up any contraindications, and there's support for professionals in prescribing that. We then know that there's an e-prescribing system in place that provides the governance and the assurance and the safety to enable that drug to be prescribed effectively and electronically. And then there are ongoing drug monitoring programs and all sorts of roles across the NHS in terms of pharmacists, community pharmacists, medicines management teams that are constantly looking for assurance around how drugs are being used, the spend against those drugs, the quality outcomes that are coming from that. Digital health isn't the same. It's a bit of a wild west. So what we do at Orca is we start with trust and we build out digital health frameworks. So you may have heard of the DTAC, the Digital Technology Assessment Criteria, so that any app that's used in the NHS should meet the DTAC. And there's also ISO requirements as well. So the ISO 82304 is a specific set of standards that we should be using. And we work with countries, including the NHS and other countries, as I've just described, to build out those quality frameworks. So we take into account things like GDPR around data protection, security, looking at evidence frameworks, looking at NICE guidance around clinical efficacy to make sure that any app that's featured on a library is meeting those needs. The second thing we do is look at awareness. So we can assess products, and we do them very regularly, up to 500 times faster than most organisations. We follow ISO, and our Digital Health Academy, which is what I'll come on and talk about, supports access to CPD training for all healthcare professionals. It's free of charge to access, and provides not only foundational level learning, but also clinical learning too, for staff that want to know more in a specific clinical area. Accessibility, we have a formulary to make sure that any healthcare professional that's prescribing apps can do so in a really safe way, knowing that they've come from a library, but we also provide toolkits to enable them to be fit into pathways. So we want to make sure that digital health is available to everybody, but it's done in a safe way through a bundle or a toolkit. And then finally, governance and assurance. Through the work we do at Orca, if an app, for whatever reason, failed to meet a review, if it was upgraded as an example, we would know instantly that that's the case, and we can put out notices to say there's an issue with this particular app and we'll remove it from our libraries. So we're making digital health as safe and as effective as it can be, But I guess the challenge that we've got is, how do we get that message out to staff? How do we get that message out to organisations? So it starts with trust, as I've explained, and there are multiple frameworks that we work with, but there are common requirements around data and privacy and usability and accessibility, and also clinical efficacy. And these are the types of organisations that we're working with. So I've mentioned already NHSX and the DTAC, they're now part of NHS England, and NICE and ISO guidance. This is just an example of some of the frameworks that we work with. So across the different countries, and you can see through the work that we're doing at Orca where we're covering off against every single one of those frameworks. So making sure that rather than someone waving the phone and saying this might be a good app for you to use, that there's actually an informed assessment that sits behind those prescriptions or recommendations. So we deliver really safe digital health to patients and citizens. And I guess you may be sitting on this webinar thinking, well, that's all great, but what's that got to do with me? And I guess this is about how do we train people? How do we raise awareness? How do we educate healthcare professionals, especially against the backdrop of needing to transform workforce in a different way and recognise that the digital technology that we've got, we need to keep moving forward. So against a backdrop of, you know, health systems busting at the seams, working at OPAL level 4, sometimes dangerous levels, as we probably will all have read in the press, etc., over recent weeks. And against that backdrop, how can we actually streamline some elements of service where we've maybe relied on a previous intervention with maybe a patient coming to an outpatient clinic, or a patient that's waiting on a waiting list for surgery or treatment, and we know that those timescales have really outrun. They could actually be looking after their own care with an app whilst they're waiting for that treatment. That, you know, let's keep people well while they're waiting for surgery. So if someone's waiting for hip surgery, then let's make sure that they've got the mobility exercises that they need to do to keep them pain-free. Let's make sure that their diet is as good as it can be. Let's make sure that we're supporting them with pain management while they're waiting. And this is where, for me, digital health technology really comes into its own. Similarly, if we think about once patients have had treatment and they're discharged from care, what can we be putting in place to support them and their families through digital health apps that takes some of that reliance away from healthcare professionals who are ultimately really, really busy. And this is where I see that technology can really play a role with better education of healthcare staff. And so this is where our academy then comes into its own. So we've built a digital health academy. It's available across the Orca platform, but also through the Health Education England Learning Portal too. So it is accessible to all staff working in healthcare within the NHS. It's been designed to be run through really easy 5-minute bite-sized videos, and it's CPD accredited as well, so really fits in with people's portfolios. It can be picked up and used, and you could watch maybe 2 videos and then come back to it another day. You don't have to start at the beginning again. But this is then backed up by very specific clinical modules. So if you're working in the field of physiotherapy and MSK, that you can actually then do the MSK module when you've done your foundation modules. If you're working in the field of maternity, there's a maternity module, and we're building out these modules all the time. So we've got mental health, we've got support around elective care, we've talked about maternity, we've got information around patient public engagement and how to get people more involved through that route. So there's lots and lots of clinical modules there. And I really wanted to bring that to people's attention today, because from an accessibility perspective, and at a time when people are really pressured, but we're trying to maximise the transformation of digital health. It can actually really help people in terms of educating how they can be using apps safely and effectively. So just a bit more information, and I've put up some testimonials there that we've received. I'm not going to read through all of those, but you can see the range of NHS organisations, British Dietetics Association that we're working with, where we've got some testimonials. It was the #1 access catalogue on Health Education England's Learning Hub. It has been embedded into several learning platforms across the NHS. So organisations that we're working with who've said, you know what, it would be even greater if we could have this on our own L&D platform, and we're able to do that. And we're working with 10 integrated care systems to continue to build out that content that's relevant to all healthcare professionals as they embark on their digital training. We've had over 8.4 million impressions with healthcare professionals so far, and a 1.68 reach from media coverage. So we do talk about it extensively on things like LinkedIn and Twitter. But for me, these webinars are brilliant because we're getting right to the heart of the people who can influence its use. And so that's why today is really important for us. I guess the other thing to say is it fits in very well with the What Good Looks Like framework around digital health education that was published at the back end of 2021. And so it is about how do we digitize staff through training, through empowering, through safe practice. How do we connect people? And that's, again, what the Academy is trying to do. So we've got peer knowledge pages on there to enable us to transform and ultimately improve care, which I guess is why we're all here and do the types of roles that we do. So it fits very much in terms of the What Good Looks Like framework around how we improve the percentage of digitally trained staff between now and 2025. I guess what I wanted to do is kind of coming to the end of my presentation, so more than happy to take questions, but I also just wanted to put up this QR code to say it would be brilliant if today some of you went away, looked at our Academy, maybe downloaded it and tried it for yourself and gave us some feedback. So I've put the QR code up there, which would take you directly to our the Orca Academy website. There's a bit of an introduction from Liz, our Chief Executive, and then you can get into those modules yourselves. So maybe I'd encourage you to take a look at a couple of the foundation level modules, see if you think that they would work for your staff, and it'd be great to get some feedback from you. But I'm going to stop there because I'm conscious that we're 25 minutes in and want to allow a couple of minutes for questions before we close today's webinar.
Alison, I thought that was fabulous. Thank you so much. I think just a couple of points from me, and we have got one question as well, which I'll reference in a minute. But I think, you know, from my own personal CPD, that was brilliant. I think obviously the relevance to things that are within our people plan, you know, around new ways of working, role redesign, etc. Obviously, this can make a significant contribution to help with that. I think the fact that as people professionals, we can open up access to this for our colleagues, our clinical colleagues within our organisations through the Health Education England Learning Hub, I think you referenced it as, you know, I think immense opportunity there. So thank you very much in a relatively short space of time. So that's brilliant. It is.
Challenging half an hour.
Yeah, no, it's lovely, really bite-sized, but I'm conscious, like you said, of time. And we have got a question here from, my apologies, it's in there as B Nuttall, number 2. So I don't know what your first name is, but you can probably just see that in the chat. So it says, to support the continued application of digital healthcare, would you agree that a collaborative approach between HR, business managers and strategic planners is needed? So that we can identify the need for developing a technologically trained workforce in key areas in the NHS where it can be proven that digital health is the way forward. So a very comprehensive question. Thank you, B Nuttall. What do you think, Alison?
I absolutely agree. I think One of the challenges that we face, and we work across, as I say, multiple organisations, is we tend to have to do it in, I'm going to use the word bite size, we tend to have to do it in a fragmented way. So we are working across regions with the CNIO network, with the CIO network, with individual acute trusts, and then at a national level with Health Education England and NHSE. And I think that, that there is, we know that there's enough interest in the academy from the people that are already using it, and from the testimonials that we've got back. I think there's a massive opportunity to do something with the HRD network, and understand from a workforce perspective, getting underneath the targets and the way that you're addressing workforce transformation across your organisations and also through HPMA. I think there is an opportunity for greater collaboration there. I think that if Liz, our chief exec, was here, you know, we're well aware that we're a commercial organisation, and that sometimes turns people off a little bit. But what I would say is everything we are doing is to improve healthcare, and whether that's through getting the right bundle of apps in front of mental health practitioners so they can make an informed, safe choice about what they're recommending to patients, or actually working with through the academy to really push out the messages around how we can educate and train better, so we reduce the fear in terms of digital health technologies and their impact. I would wholeheartedly say yes to that question.
Sorry, I thought I'd come off mute. I just said that's great. Thank you very much. And also thank you very much to the colleague who put the question in. I can't actually see any other questions at the moment. And I am conscious of obviously keeping within time. And it may be that colleagues, as we customarily do these days, have got back to back. So I guess what I'm going to suggest is, Alison, that we say an enormous thank you for the preparation that you've done for the session today, and for what you, for me, certainly you've opened my eyes, and I hope that's the same experience that colleagues on this call have had. So thank you on behalf of the HPMA. And to colleagues that are on the call, thank you very much for joining us. It's always a pleasure that you are able to do so. Please do share this information with colleagues. It will be available on the website. You will get the opportunity to give some feedback through an evaluation. So please do that. And obviously share with myself and colleagues in the HPMA other sessions that would be useful for you. And I get a sense, Alison, that this could be the start of the development of a beautiful relationship, because I feel we've only just lifted the lid on this. And that, you know, I think the opportunity for further conversations we should explore. I really should.
Definitely. And again, just to say thank you so much for the opportunity this afternoon. And yeah, please do look at the Academy as well.
Lovely. All right, everyone, have a good rest of the afternoon. All right, best wishes. Bye for now. Thank you.